You know, I also want to tell you thank you for the marks that you've put on this budget. Any budget we have, while it may come through a committee that I get to chair, is not simply the marks of the committee. It simply isn't simply the marks of the chairman. It's really the marks of each and every senator. And I hope you see the reflections of what you've asked for reflected in this budget as well, as you've worked to represent your constituencies and your hometowns. One of the true frontline workers in this pandemic has been school nurses. And the Senate proposal, because of senator requests, various and many, numerous senator requests, adds $4.1 million at line 149.8 to provide school nurses with parity to the teacher increase you'd see as well. It'd be $2,000 for every school nurse on top of, in addition to, or as well as what there's being paid to teachers. To thank them again for the efforts they've put through in this pandemic. While we have the budget now in the Senate, the governor starts that budget, we know that we couldn't be at this position that we are now without our help from colleagues across the hall in the House of Representatives and the House Appropriations Committee. Many of you may have heard already that Chairman England has announced that he will not be returning next year to the House. And while that is a great loss for that body, it's a great loss for this body as well. He has been a strong leader, a strong mentor, and a friend. And his heart and compassion will be reflected in Georgia budgets for many decades to come.
I'm here to present SB 403. Basically, it establishes a statewide framework for community-based co-response teams to intervene in a public safety emergency, deliver mental health services, and divert an individual in crisis toward a continuum of care and all available community resources. Let me just explain and give an example, a little story of how this has evolved. A police officer, a law enforcement agent, comes on the bridge with a behavior specialist. But this law enforcement agent is part of the Sheriff's Department, Chatham County Police, one or the other. He is trained in behavior crisis. He has along with him a licensed clinical social worker or someone who's also trained in behavioral crisis. The example that when Mr. Beal and I visited the Behavioral Crisis Center that they gave us in this particular situation with a person on the Talmadge Bridge is they actually took up the director of the psychiatry residency program with them to the bridge. After discussion and counseling and more counseling and discussion, the director of the psychiatry residency program noted that, that they could work with him, gained his trust, and they took him in what they had come in, an unmarked police car by the behavior specialist and the law enforcement agent who is not dressed in uniform, but who has a golf shirt, khakis. That is his uniform. Much less threatening, no blue lights, no sirens, a soft environment that they take him to the Behavior Crisis Center, in which they enter, not in the front door, but on the side door. Take him in the side door, and if he has a substance abuse disorder, he's detoxed. If this is a crisis, a psychotic break, whether related to unipolar or bipolar disorder, schizophrenia, then they are treated.